Hi, my name is Kirsten Running Marquardt. I'm the director of Iowa for Healthcare. I stand here with proud healthcare voters from Iowa. Last week, the Iowa legislature passed a healthcare bill that would bring universal coverage to Iowa's 50,000 uninsured children by 2011 and allow the state's young adults, who are the largest and fastest growing uninsured group in the nation, to stay on their parents' health insurance plan until they're 25. This reform did not come easy, not by any means. It took years of work by our leadership at the Capitol with the help of our governor and groups like Iowa for Healthcare and healthcare voters that stand with me today. Iowa's reform is not perfect, but it is a clear step forward. That is why we cannot understand that John McCain would come to Iowa during Cover the Uninsured Week and ask us to accept his healthcare plan that would only make our healthcare crisis worse. The majority of Americans get their health coverage from their employer. But as healthcare costs continue to rise, more businesses are declining to offer health coverage to their workers because they're being priced out of the system. A new study by the Robert Wood Johnson Foundation showed that from 2001 to 2005, health insurance premiums have increased 19.5% for Iowa's families that receive their health insurance from their employer, while the average income for those families has dropped 1/3% in the same time frame. McCain's answer to this problem is to make it even worse by eliminating the existing tax breaks for employers who provide their workers with health insurance. This will discourage employers from providing coverage and leave workers to fend for themselves on the individual market. John McCain will tell you that creating competition and less regulation within the individual market will lower costs and get more people covered. This is simply not true. Forcing everyone into the individual market will price even more people out of the system. In fact, MIT economist Jonathan Gruber estimates that 1.2 million people would lose their coverage if their employers stopped providing it because they couldn't afford to purchase it themselves. The only people Senator McCain's plan would help are the fat cat insurance company CEOs whose swollen salaries are already topping $32 million a year. So what about those Americans who make above middle class wages? The people who, even if they lose their employer's insurance, McCain's tax credit would only help to cover the difference. If this is you, you'd better hope that you've never had a serious injury in the past or illness, because under John McCain's plan, insurance companies would be allowed to discriminate against people with pre-existing conditions. Without regulating this, insurance companies can cherry pick the healthy by charging unaffordable premiums or even denying coverage to people who have any sort of pre-existing condition. The senator is criticized for this part of the plan because he himself would be denied coverage on the individual market due to a bout with melanoma 15 years ago. Lucky for Senator McCain, he is covered by the U.S. government under the Federal Employees Health Benefit Plan. In a nutshell, Senator McCain's healthcare plan would shift the burden of unaffordable healthcare costs from the employer onto working families. I urge, and we urge at Iowa for Healthcare, for Senator McCain to reconsider his position on this issue. Because if he wants the support of Iowa voters who care about healthcare, his plan must bring quality, affordable healthcare to every man, woman, and child in this country, not just the super healthy or the super rich. Thank you all very much for coming.